Hello, I'm Natasha Tracy. This is Breaking Bipolar for HealthyPlace.com. Today I'd like to talk a little bit about what happens when you first start trying medication. I've received a couple messages from people who are in this situation, and I think people need to understand a couple of things. First, medications can take weeks to work. Your doctor may start you on a smaller dose and then work you up to a larger dose. This will likely get you into what they call a therapeutic range. This means that you're taking enough of the medication to actually achieve the therapeutic goal that you're going for. It can take time to reach that level. But once there, the medication may still take weeks to work. This might mean that you need to be on a medication for, say, 6 weeks before you can determine whether that treatment was successful or not. I know this seems like a long time, but there's nothing like looking back at doing 5 different drugs and not being able to determine whether they were truly therapeutic or not due to the fact that you didn't stay on them long enough. Secondly, side effects. When you first start a medication or when you increase a dose, you may find that you have significant side effects. This can happen to anyone on any medication, but these side effects may go away over time. But again, it may take weeks to determine whether those side effects will go away or not. This means that, again, it may take you weeks to determine whether you can live with the residual side effects. Now, I've been doing this a really long time, and my tolerance to side effects is very high, but it's individual per person, and you have to decide what you personally can live with. Now, if you've determined that you cannot possibly wait for a full medication trial, or you cannot possibly live with the side effects, then you have to see your doctor. And you need to be really open about the issues that you're having. You need to tell him specifically about the side effects you're experiencing, or specifically about the symptoms you're experiencing that aren't allowing you to wait to see if that therapy is going to be successful. Your doctor may have ways of mitigating the side effects or possibly boosting the efficacy of the drug, possibly by a dosage increase, for example. But you need to be very forthright with your doctor. You need to say, I'm experiencing side effects X. It is affecting my life in the following way. I consider that to be unacceptable. What is your treatment plan for dealing with that? Whatever your issue is, your doctor needs to address it and have a plan as to how to handle it. Now, you may both agree that you can wait another week, or you may both agree that it's time to get off the medication. It really depends on who you are and what your situation is. But I do encourage people to be open with their doctors. Your doctor is there to help you, but they can't possibly do that if you don't tell them what the problem is. I'm Natasha Tracy. This is Breaking Bipolar at HealthyPlace.com.